My name's Shelly, and I've got my 44-year-old patient John here, who came to see me today for his annual physical. And he did come in this morning and have some fasting labs done. That way we could have the result why we are visiting today. Now, last year when John came in, we had some questions of possible type 2 diabetes or even a pre-diabetic state. Last year, his hemoglobin A1C was 6.9, and his fasting glucose was 124. So we had a lot of discussions about lifestyle changes because he was not willing to accept his diagnosis and start on medication. So I told him I'd give him 6 months. It's a year, and now I'm seeing him for the first time. So a year later, like I said, he came in early for fasting labs, and now we will visit and go over everything. Like I said, he's a 44-year-old male, even though he doesn't look like it. He is an obese man with a cardiac history. He has coronary artery disease. At the age of 42, had a pretty severe MI with stents done in a cardiac or in the cath lab. He has hyperlipidemia. He has hypertension, and like I said, coronary artery disease. His family history, his mother had type 2 diabetes and coronary artery disease, and his father had hypertension. So he does have a pretty significant family medical history as well. His daily medications, he takes Plavix, metoprolol, amlodipine, Protonix, Lipitor, and a multivitamin. The couple things on his labs that we did notice, his CBC was insignificant. Everything looked great on his CBC. His creatinine was 1.2, which is normal, so your kidney function is good. Your potassium levels were within the normal range at 4.5 as well. Now, today, your fasting blood sugar was 201, which is exceptionally high. We like to see that on the lower side of even less than 100 for a fasting in the mornings. And your hemoglobin A1C is 8.1, which is not good. And that has gone up from last year when it was 6.9 and we discussed a type 2 diabetes diagnosis. Your HDL 62, LDL 110, and your triglycerides are 161. So as you know, those are part of your cholesterol panel. And again, those are a little off, but not too bad. They're looking better than what they have in the past for you before you had your MI. So this year we are going to diagnose you as a type 2 diabetic, and it's gone beyond just lifestyle changes. You had a year since I've seen you last to make those, and those were unsuccessful attempts. So I think now's the time that we intervene with some medication as well. I know you have an understanding of type 2 diabetes and you have an understanding of how to check blood sugars because of your family history and you've seen it at home and you've been around it. So we'll get a prescription for a blood sugar monitor for you so you can do that at home. I want you to check your blood sugars every morning as a fasting and then 2 hours after any meal of the day, whether it be lunch or dinner or whichever is fine with me, just so I can see some postprandial blood sugars also. I will refer you to the diabetic center that we use at the hospital. They have all kinds of different staffs there, but most importantly, there's a dietitian. And I want you to meet with the dietitian to go over some nutrition suggestions, meal planning, things like that can really help you along with this diagnosis, okay? With being diabetic and with taking treatments, I think it's important to cover hypoglycemia with you. So hypoglycemia is when your blood sugar is low. Currently, you're hyperglycemic and it's high, but once we start to add some treatments, there's always that chance of lower blood sugars. The meds we're adding should not do that to you, but just in case, some of the signs of hypoglycemia are you get shaky, you get hungry, you get sweaty, headaches, some anxiety. So because of that, I want you to always have some kind of snack nearby, whether it's a little piece of candy or if it's peanut butter and crackers or some juice or something like that. The medications that I am recommending for you to start on are called Jardiance and Trulicity. Jardiance is a daily pill. You'll take 10 milligrams a day. In addition to the type 2 diabetes that it'll help you with, it also has some excellent cardiovascular benefits. There are some FDA studies that shows that it can really relax the vessels so they're not so stiff. So that'll really help. Since you have that cardiovascular component as well, it will assist with that. Like I said, it's a daily medication. It's